It's Women's History Month, and we are continuing to highlight women who have contributed to make LA what it is today. One of those women is Dr. Lisa Nicholas. She's devoted herself to the field of obstetrics and gynecology for 30 years now, both right here in LA and across the globe. She's passionate about medical education as the associate clinical professor at UCLA's David Geffen School of Medicine. She's also made it her mission to address structural racism and inequity in medicine and to provide quality health care to women of all ethnicities and economic status. Let's start with what inspired you to get into the medical field?
Well, I can't say it's probably one singular thing, Amy, that inspired me, but I can tell you that my parents were always very encouraging to me all throughout my life as a child and as an adult now. I've always loved science and nature and fixing things. And, I always had questions of why, where do the things come from? And I just always had that inclination. But I was very influenced by a pediatrician. Her name was Dr. Lydia T. Wright, who seemed to be just so magnificent in everything that she did with the care of her patients, with her interactions in the community, and the respect that she had really experienced from everyone around her. And I said to myself, I think I would like to be like her because she looked like me. But Amy, I must say that that wasn't something that was very much embraced by the teachers when I was in school in regards to encouraging certain students with career paths, because we had guidance counselors back then. And I remember going to the guidance counselor's office when I was about a preteen, and I said, I want to become a doctor. And she looked and she said, I don't think that that's a very realistic aspiration for you. So I was really crushed by that. But fortunately, I had a village around me to help me to keep this dream alive.
Tell us a little bit about how you think women can really advocate for themselves when picking a doctor.
Well, that's an excellent question, because there's doctors that really can give phenomenal care, and then there's doctors who may not have that compassion, that understanding, that skill set that all women deserve when they go to see their physician. One of the things you must have is a physician who's willing to listen to you, who's willing to communicate with you, explain things to you, and not talk at you, but have a conversation with you. And the doctor shouldn't be afraid to allow your family members or your other support people to be engaged in that conversation. You want to make certain that person is accessible to you and that's willing to go that extra mile when you need them.
What advice do you have for other women looking to pursue the medical field? I know that your own daughter is also a doctor. So what advice did you give to her and do you give to other women?
Oh, I'm so proud of my daughter, Lindsay. I mean, she's just a phenomenal doctor. And she's been that way because of something that she's earned on her own right. But I would tell young women who are interested in pursuing a career in medicine to believe in themselves, to not think of the noise going on around them that may suggest that they're incapable of realizing this dream. But then they have to plan, they have to be prepared, and they have to persevere. Because there are going to be times when there'll be very, very dark days, and people will tell you that you can't do it. And then you start believing that yourself. But you have to push those thoughts away and keep positive thinking and positive people around you so you'll be able to move things forward.
Oh, excellent advice, Dr. Lisa Nicholas. Thank you so much for being with us today.
Thank you for the opportunity, Amy.